Good evening, everyone. Today we are going to discuss on the topic mathematics in medicine and pharmacy. Abstract. Many of the technological advances that physicians use every day are products of concerted efforts of scientists, engineers, and mathematicians. One of the ubiquitous applications of mathematics in medicine is the use of probability and statistics in validating the effectiveness of new drugs or procedures or estimating the survival rate of cancer patients undergoing certain treatments. Setting this aside, there are important but less known applications of mathematics in medicine. The major topic: pharmaceutical industry. Dispensing medications. Nurses must translate medication orders into the right doses and number of pills to administer. Essentially, the number of pills needed equals the dosage of desired divided by the dosage of the hospital has on hand. For example, if a doctor orders half a gram of the drug every 12 hours and the hospital has 250 milligram pills, nurses must divide 500 milligrams, 0.5 grams multiplied by 1000 by 254, 2 pills every 12 hours. Using these formulas often requires nurse or pharmacy technician to convert units of measurement, such as grams to milligrams. Next, in the operating room. Math is critical to help anesthesiologists concoct safe solutions and right levels of oxygen for surgical patients. They consider variables such as patient's weight, the desired drug or solution dosage, and amount of dilution needed so that the active chemical is not too strong. A successful anesthesia practice requires command of converting English to metric units, such as pounds to kilograms. In facial and plastic surgery practices, physicians run math-generated computer models to project the results of procedures. The next topic or next field is making facilities run efficiently. Health data analysts collect and crunch numbers to help medical facilities better serve patients. The data may include wait, service or recovery times, and instances of multiple appointments and visits for the same or similar conditions. From the figures and mathematical models, analysts, administrators, and physicians may implement time-saving and more efficient techniques and scheduling. Statistical models help analysts identify the factors that determine the length of recovery time and successful recovery periods from various diseases and conditions. The bottom line. Accountants calculate the profits and losses of healthcare facilities, while administrators oversee the finances. Traditionally, medical centers count revenue when the patient is admitted or receives outpatient services. When accountants report revenues based on cash, they must tally insurance reimbursements, out-of-pocket payments, and government assistance. Donations also add to revenue. Administrators use math skills to prepare budget and reports for honors and ministries. Calculating dosages. Nurses with an order to give 750 mg every 4 hours as needed for pain may receive 250 mg tablets from the pharmacy, requiring them to calculate the number of pills to administer. They also need to calculate the amount of medicine to give when drawing up liquid medicine for injection. An order to give 7.5 mg must be compared to the vial, which states 5 mg per cc. Some medication orders require the nurse to calculate the dosage based on the patient's weight. Calculating IV drippings. Large bags of IV fluids contain 1000 cc or cubic centimeters, also known as milliliters. An order may give 1000 cc every 2 hours, necessitating a calculation of the proper drip rate. A small bag of antibiotic medicine may have an instruction to give 500 mg over 30 minutes. When IV medicine must be given without an electric pump, the nurse must calculate the correct number of drops per minute to administer. Drug titration. Certain drugs are titrated, meaning that dose varies according to parameters set by the physician or protocol. In the intensive care unit, a patient may need a varying amount of intravenous drug that is calculated by factoring in his urinary output per hour. For example, insulin may be titrated depending on the patient's ever-changing blood glucose reading. Drug titration requires the nurse's full concentration on her mathematical skills and is often limited to nurses with special training or experience. Moving on to the other industry, which is medical industry. Ultrasound and MRI to cure cancer. A lovely applications of imaging technology leads to a direct treatment for cancer. One of the most commonly used forms of medical imaging is ultrasound, which are sound waves of high frequency, much higher than we hear. Sound is a compression wave to a tissue, and its speed, c of x, depends upon the density of the material. The sound intensity u of x, t then satisfies the wave equation. Spot check non-invasive blood pressure NIBP monitor. This is a more sophisticated version of the automated device and is designed for routine clinical assessment. There may be an option to measure additional vital signs such as oxygen saturation in the finger pulse, SpO2, and body temperature, mains and battery powered. The major topic: CT scanning. Computer tomography scanning is essentially an extrapolation of the concept of an X-ray. Instead of taking a single X-ray from single perspective, a CT scan rotates a point source of X-rays around a body to be imaged. This exposes film on the opposite side of the object. By making calculation from the level of the exposure of the film, one can determine line integrals of attenuation coefficient mu through the object. Taking the calculation from a full rotation, it is possible to reconstruct 2D slice of the object. Compilation of multiple slices allows for 3D reconstruction of the object. Essentially, the mathematics of CT scanning involves two problems. In the forward problem, we model the data obtained from the real-world CT scans using radon transform. The radon transform uses us to create film images of the objects that are very similar to those actually occurring in X-rays or CT scans. The inverse problem allows us to convert radon transforms back into attenuation coefficient using the inverse radon transform to reconstruct the body from a CT scan. Now, EKGs or ECGs. An electrocardiogram records the electrical signs and signals in your heart. It's a common and painless test to use to quickly detect heart problems and monitor your heart's health. ECGs or EKGs are often done in a doctor's office, a clinic, or a hospital room. The electrodes are connected to various parts of your anatomy, and voltage differences over time are measured to give the ECG. MRI. MRI, as you know, magnetic resonance imaging, is a very important clinical imaging tool. It combines different fields of physics and engineering in a uniquely complex way. MRI is also used surprisingly versatile pulse sequences that can be designed to yield many different types of contrast. This versatility is unique to MRI. MRIs use electromagnets, which are essentially coils of wire which generate a magnetic field when current is run through them. Regular electromagnets are great for generating magnetic fields, but an MRI needs a magnetic field that meets two specific criteria: uniformity and high strength, both of which cannot be accomplished with the average electromagnet. Conclusion. There are so many ways that maths is vital in human and veterinary medicine. Medical professionals may be calculating the risk of a disease spreading, how much medicine to give, how quickly the heart is beating, or whether a patient is improving or declining. The next time we are doing some maths, think about the ways it might be useful for doctors, nurses, veterinarians, scientists, and other people working to make us healthier. And thank you for your time. Have a great day.